of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors.
Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Good evening, and thank you for joining us here at You and Your Doctor. I'm your host, Melissa Santiago, and I'm very happy to present and introduce Dr. Jeffrey Stein. Welcome to the show.
Thank you. It's nice to be here.
Thank you for being with us. So I understand that you want to focus mainly today on concierge medicine.
What I'd like to do is sort of give the benefits of concierge medicine in the year 2017 and how it can benefit patients tremendously. With Obamacare, a lot of patients left a lot of doctors' offices because we could not get on the healthcare plans. And patients were getting frustrated because they weren't able to spend enough time with their doctor. And they were having to be seen in and out every 2 minutes. And patients were feeling that they weren't getting the attention they deserved. The concept came about 10 years ago, 15 years ago, and it has just taken off.
It's been 10 to 15 years that concierge medicine has been available.
About 10 years, yes.
What brought it about? Because this is relatively new for me. I've never really heard much about concierge medicine, and I thought maybe it was something that was brought on because of the healthcare changes. But you're telling me it's 10 to 15 years.
Yeah, well, I first heard about it with a program by the name of MD VIP, which is, I believe it was out of Seattle, if I'm not mistaken.
Okay.
And it was a concept where doctors were made available to their patients 24/7. And it was VIP medicine. And they're all over the country. And so if you're in Washington, D.C. or Chicago and you're an MD VIP concierge patient, you could see that doctor at the drop of a hat. There are a lot of hybrid models out there, doctors doing both through other concierge programs that are available in this country. Mm-hmm. We do our own model through a hybrid situation where we have some patients who are grandfathered in, they're Holocaust survivors, or they've been with me for 25 years, and so their incomes are limited and they're in their 90s, and we sort of
make adjustments for them.
Yeah, scholarship them, if you would.
That's great. That's great. So tell me a little bit about it. How does it come about? When does somebody say, I'm going to consider concierge medicine, I want to learn more about it? Why would somebody think of that?
Well, I think it's an individual choice. Some patients don't have the time to sit in the waiting room. Some patients don't have the time to access the subspecialty modules. Some patients feel as though they need that extra attention, depending on their healthcare issues. Some patients who are more needy than others might have multiple medical problems, mm-hmm. and they require a little bit more hands-on care.
So are you saying that the difference between concierge medicine and just going traditionally to the doctor's office, there's the benefit is that they can get to you a lot quicker and don't have to wait as long for an appointment?
Yes, it's basically that it allows patients that extra benefit, but they're not treated any differently than a regular patient is really treated upon priority who is the sickest patient who comes into the office. However, if it's a routine visit or if it's someone who has a cough and cold, they'll come right in. Mm-hmm. They won't have to wait. They go right to an exam room. They're treated expeditiously. We expedite their treatment plan. If they need to get to a subspecialist, we expedite that as well. It would be nice if we could do that with everyone, patient.
Right.
But the insurance company reimbursements have changed over the past 10 years. And
tremendously.
The reimbursements have been carved out so that it doesn't allow us to spend 30, 40, 50 minutes with each patient because of the healthcare changes. So this concept really benefits the patient. Mm-hmm. It also helps the doctor that he can spend the time needed that patients deserve.
Right. Yeah, I have a personal experience myself with Obamacare, and I was an independent contractor, and I had to get my health insurance through the marketplace. And all of a sudden, I realized my doctor's not my doctor anymore. And whoever I did go see, I didn't know them, and I was in there for maybe 10 minutes, and my insurance didn't cover anything. So would you say that that's probably why a lot of people do come to you for a concierge?
Well, I think that patients come to me for referral for concierge because of just that, of a referral from another patient, and they enjoy our practice, and they enjoy my staff. I had a very dear friend of mine who was my patient for 10 years, but he was my friend for 20 years, and he was on Obamacare.
Right.
And we could not get on his health insurance. We just couldn't. And it was costing him $10,000 a year less to go on Obamacare, so he had to leave my practice. And I understood. I mean...
Of course.
But patients who come to me through concierge medicine either do it out of their own personal needs, or it's the kind of care they want.
Right. Yes, that makes sense. What's the average range of age that the patients are that come to see you for that?
I'd say our average right now is probably under the age of 60.
Okay, that's surprising.
It was when I first started this. I was expecting more of a geriatric predominance, and I was quite surprised in terms of when we did the demographics and the age. The bell curve was 80% under the age of 55.
Wow.
And I think it's because the working class person or patient who really cannot wait in a waiting room because it costs them money, or they have a job and they just can't afford to be sick, wants the ability to get in to see their doctor, get in, get out, and get on with their lives. And I think that's what motivates some of these patients to do so.
Okay. Now, how does it work with you? How does the payment work? Is it something that's done monthly, quarterly, annually?
We have an annual charge. It goes from January to December. We have made some exceptions in terms of helping patients make a payment over the 3 months. Otherwise, it becomes an accounting nightmare. We try to help the patients in terms of financial assistance with that. But it is one payment up front. Where there are probably about 30 or 40 concierge practices in the area. As far as price range, they go anywhere from $1,500 to $5,000, $10,000 across the country. Somewhere like in the city, New York City or Manhattan, or LA or Beverly Hills, and they can be $10,000. It depends what the market develops.
Right, I understand. Now, as far as your services, once a patient pays the fee up front, which is cash only, right? It's not covered by insurances.
Correct.
Okay. So they pay the premium for you guys, for the retainer. And what does that include for them?
So their annual fee includes access to me 24/7.
To your cell phone?
To my cell phone.
Wow.
They have a private email. They have an actual private line into the office where there's not an automated, press 1, press 2.
You get a live person.
You get a live person who answers that line for that patient. And with that, we try to help them with samples, extra samples for their medications that are expensive. If I know that they're on a medicine that, let's say, costs $200 a month, I'll try to get the pharmaceutical rep to help with some samples to sort of
alleviate
augment the cost of the concierge fee.
Right.
But there's one couple that are in their 70s, and their bills are $500 a month for their pharmaceuticals. And I've probably saved them easily their cost of their concierge fees in just their blood pressure and diabetes meds alone, which is great because then they're not paying the money. And it would be great if I could do that for every patient, but there is a business model that allows me to only do it for certain patients.
Right. It makes sense for them in that regard. If you have high healthcare expenses and you have maybe a chronic illness that constantly needs attention, then perhaps versus paying for insurance, they can pay for the retainer.
Well, the insurance has nothing to do with it. Their insurance really is still their insurance. They still have to pay for their own health insurance.
Do all of your patients have health insurance? Though I just kind of assumed that they didn't have health insurance.
No, every one of our patients, not everyone, but the majority of the patients have health insurance.
Okay.
This has nothing to do with their health care, with their Blue Cross, United, Aetna. That has nothing to do with it. This is over
Thank
and beyond.
goodness for that, right?
Oh, thank God for that. We have some patients that are, they can't get health insurance and they're on a cash pay basis. So we discount for them.
Yeah.
We have our own lab in the office. So if, the cost for submitting to a lab if you're a cash pay patient is astronomical. So we were able to discount lab fees for patients that are cash pay. We have a wonderful nurse practitioner in my office named Peggy Zapantis. She's one of the smartest nurse practitioners I've ever had the pleasure of working with. She's amazing. She does, some of the women's health care. She ran a healthcare clinic for her PAPs, and she's wonderful, and we have a wonderful staff.
So combined with experience, I mean, you've got about 30 years experience under your belt. No,
not that many. I'm not that
20?
old. We'll call it 25. We'll come meet you in the middle.
All right, we'll say it's 25, and then with the experience of a nurse practitioner, you guys are pretty knowledgeable in what you're doing, and you're located in Boca.
We're
right?
on Boca. We're on Glades Road, 9291 Glades Road.
Okay, so that's West Boca.
That's 1 mile west of the Turnpike.
I think I know exactly which building that is.
We're right next to Rooms to Go.
Yeah, Macy's Furniture.
Yep, between the two.
Okay,
we have,
great.
And I'm on staff at Boca Regional and West Boca Medical Center, so I have hospital privileges at the two
hospitals.
Great hospitals. And
your phone number for patients who are interested in learning more is 561-483-5500. Feel free to call his office to get some more information if you have any questions. And, concierge medicine. Now, you've got me thinking about concierge medicine because it is true. I do work full-time, more than full-time, actually. I'm a single mom also. I have a teenager at home, and I don't have time to go to the doctors. Or what's most frustrating is when I need an appointment immediately and I have to wait 3 weeks. That's what's really frustrating sometimes.
Well, and that's, not only that, but if you were, let's say you were a traveling young mother, or you're a traveling individual and you're in Philadelphia and you had a sore throat or you had an eye infection.
What happens then?
You'd call me on my cell phone, and I'd be able to either via Skype or, FaceTime you to look at your eye or whatever, and we could treat you over the phone on a weekend where typically you'd have to call, one of the covering doctors. He may not call you back for a couple hours or that day, or you're forced to go into a walk-in clinic that you don't trust.
Or don't know, and yeah.
So with that, it gives you the benefit of, having the access to me when you're at home or
away,
with your child or whatever. And that's what it's really designed for.
For convenience.
Growing up, I remember having, call the doctor on his home phone. And so that's kind of the model that we like to continue using.
So I imagine with this personalized care that you offer and this VIP care that you offer, how many patients do you have?
We limit, it's a very great question. In other words, we limit the number of patients per year.
Because you need the time for each individual patient.
Correct.
Okay.
So some of the practices are unlimited, so we limit ours to 300 patients per year. Once we're at 300, then we have a waiting list. And obviously there's a turnover. Patients move. Some patients, unfortunately, as they get on in life, they die. But we have a very low turnover rate, which is great. And we try to accommodate, at a moment's notice, and it seems to work. We've been very successful. This is our 5th year, and we, recently I was named Doctor of the Year for Boca Raton by the city.
That's amazing.
So
Doctor of the Year, and that's internal medicine. That's primary care. It
was all fields, and it was
that's amazing.
Proclaimed by the mayor, and it was really kind of cool to have that kind of accolade.
Absolutely, it's cool that you're here on our show with us.
Oh,
yeah, that's pretty amazing. Doctor of the Year in Boca Raton, ladies and gentlemen, Dr. Jeffrey Stein. That's great. wanted to ask, and I'm sure the people want to know, in regards to concierge medicine, what do you think an individual should ask themselves before considering coming to see you or paying a retainer for the practice?
I think what you would, if I was in their shoes, I would probably ask myself, it's not only that will I only see a doctor once a year, because it's like life insurance. You never know when you're going to need it. And that's one of the many questions I get. Well, why would I spend the money if I only get it once a year? And it really isn't about the once a year visit. It really is about knowing that your doctor is there for you. We had one patient that was on a cruise ship, and he had chest pain, and he needed to get an EKG. So we emailed via through the system that we had, and the EKG that they did on the ship was the same EKG that we had, and it would turn out to be just heartburn. But if there was, it was an abnormal EKG, but it was the same EKG that was a year old. So otherwise they would have had to airlift him off the cruise ship.
Wow!
And it really did save him thousands of dollars, and it was the only time he had ever seen me. Was one time we did the EKG for the year, but it was that experience that that he benefited from,
and luckily it wasn't anything serious. But I mean, could you imagine if it was something that was dire? What would happen in that event? I mean,
well, he would have had to go through the route of being airlifted to a hospital and worked up for chest pain that might have been cardiac. In this particular instance, it was non-cardiac, but the EKG was paramount that we had something that we could email on a Saturday, because no doctor's in the office on a Saturday. So we're able to save his trip, save him the exhaustion of having to come off a cruise ship.
Right.
The expenses of airlifting would have been astronomical.
I'm sure.
And he was able to complete his trip, which was a nice thing. So I think what you should ask yourself is, will this benefit me, over the years, having my doctor, available. And a lot of times what we'll do is the patients who do it, we don't charge them for their entire family if they have teenage children come home on college. So it would be a perfect example. Let's say if your daughter was, I don't know how old your daughter is, but if she was like 16 and she had a sore throat and she couldn't get into her pediatrician, we would accommodate her without charging you for her individual fee. Each individual is charged for the concierge, but we don't charge the children because, if their grandson comes home on, visiting, we don't charge them for that. It's just
so it's kind of like a family membership type deal.
It's individualized, but we don't, we just don't charge them for each. You don't
nickel and dime them.
I wasn't going to say that, but that's correct. That's exactly the way. We try to be fair.
Right.
We also prorate it if you're a snowbird. If you're let's say you come in September and you leave in April, it's prorated for the amount. Unlike other concierge practices, we do prorate to save patients money.
That's great, and that's key down here. I mean, almost everyone's a snowbird except for us.
We're here for the duration.
That's great. So tell me a little bit about yourself. What do you like to do on your free time?
Well, I have two wonderful teenage daughters. I just dropped my 18-year off at FSU.
Oh, wow.
And so she's a freshman.
How was that for mom?
That was just horrifically depressing to drop your first daughter off for college.
Oh, my goodness.
Yeah, the tears came. And so
everything makes me cry with my son. Any little amazing thing that he does, he plays piano, and it just...
You're passionate about it.
It makes me cry.
Yeah. So I have my daughter, 18, Savannah. She's awesome.
Hi, Savannah.
And she's up at Tallahassee. Hopefully she should be in class. And then I have a senior at Spanish River, Avery, who is my other gorgeous daughter. So she better be feeding the dogs right now. We're very close. We love going to sporting events, hockey games. I'm a big
who's your team?
Florida Panthers.
Of course, 100%. Huh? Are you guys originally from here, from Florida?
No, originally I was born outside Philadelphia. I'm a Philly boy, and my Philly roots are still strong.
Go Philly!
Oh yeah, you never leave your Philadelphia. And the Jersey Shore, grew up with that. Love going to sporting events.
Yeah.
Love.
Your daughters, are they into any sports or anything like that?
Oh, they're as tomboys as you can get. They love going to. I've taken Savannah to the hockey game since she was 6 weeks old. And
oh wow! I guess she didn't have a choice, really.
No. She knows the players, and there's some local players that are in town who are my patients.
Awesome.
And I've taken care of.
That's interesting.
Yeah. So and they've retired, and they've been really great as far as coming to visit my daughters and stuff. Dolphins, Marlins, Heat. Love going to.
So you like basketball, baseball, football. You like it all, everything.
Love it all.
And the girls too.
Yep, I work out.
That's great.
I do martial arts.
What type?
It's called American Kempo.
Okay. I'm a fan of martial arts myself. Actually, I've done Filipino Kali.
Oh, really?
And Chen style Tai Chi.
Tai Chi. Okay.
Yeah.
I'm going for I just got my red belt, and hopefully get my black belt by the next year.
Very nice. Don't mess with this doctor, guys.
Love going to the beach, just hanging out.
Yeah. What beach do you normally go to?
Delray.
Okay. I love Delray.
I know.
By the way.
There's some great restaurants.
Do you know Sandbar?
Yes, actually, he's my patient.
Sandbar?
Yes,
I love Sandbar.
Yep.
It's so much fun.
They have some really fun individuals there.
Yeah.
Love going to Maine in the summertime.
Oh, New England.
Love New England,
love
especially
New England.
Maine. In the Maine, there's
How
something
about
about
the New England Patriots? Do you love them?
Next question. I want to go to Central America one day.
Yeah.
I'd love to go down to Honduras.
Yeah, you like Honduras. My family's from Honduras.
Really?
Yep.
And Argentina. That would be my 2 trips that I'd love to see.
Yeah.
Play golf. I love golf.
You're in a perfect area for golf, South
love
Florida.
Golf. Love golf.
How often do you play a week?
I play on weekends. I'm terrible, but I love golf.
Are you terrible?
No, yes, no. I'm competitive, let's put it that way.
Okay, so you're hard on yourself. Good to know. That's something you want from your doctor, right? From your primary care physician.
I think so.
Perfectionist.
Yep. I was a pharmacist first, went to the University of South Carolina.
How was that for you?
It was interesting to go to a school in the South when you were a Yankee, supposedly, and back in the 70s. It was kind of fun.
Yeah.
It was great, and I got my pharmacy degree, and I did retail pharmacy down here for 3 years. As a matter of fact, right across the street from my practices today. So my pharmacy background has really been pivotal in helping my patients too. That has really helped.
Yeah, that's amazing. It's so funny you say that because I did pharmaceuticals on the wholesale side.
Oh, you did?
For 3 years myself, and that was pretty interesting.
There's only about 3 of us in the county, I think, that were pharmacists first, and then MDs, and it really does help. We have a sort of a small pharmacy in my office that we try to help patients with some of the costs of some drugs.
Do you have a compounding pharmacy in your
We don't have a compounding pharmacy. We just have retail, just some products that patients, if we could save them.
So not only are you convenient with your concierge service, but you have the medicine right there in the office for them as well.
We do.
That's awesome.
So I have a dispensing license, which allows me to do it.
That's great.
As well as medical marijuana. We just got certified for medical marijuana, which was great.
Now let's talk about that. Medical marijuana. How often do you prescribe it? I had no idea that you did prescribe it. Tell me about that, because this is new to us, and I'm hearing all sorts of perspectives on it, and you tell me.
Well, at first I was a little bit adverse to it, and then more and more as I read the literature, there was things done on 60 Minutes. I don't know if you saw it about this young child who had intractable seizures. And
I did. I did see that.
It was very moving. And when I studied for the exam and took the exam, and I'm thinking, I'm probably going to be getting a lot of substance abuse patients trying to...
Probably, like with any controlled substance.
It's been interesting. The majority of the patients I've been getting are geriatric patients who are, with insomnia or chronic illnesses. And I had this one gentleman, he was a delight, and he was in his late 80s, and he had never been able to sleep. And he had taken an edible given to him by one of his children, and he told me it was the first good night's sleep he had in 40 years.
That's amazing.
So it is, I think there is a place for it. We're seeing it really good for my MS patients.
How does it work for them, your MS? I have a cousin who has MS, actually. He's in his early 20s.
I don't think anybody could actually tell you specifically pharmacologically how it works, as far as it... I meant like their experience with it. Are they having good experiences with it? Are you finding that so new with it? I mean, these patients have, like I said, we just started in January, and the laws just changed this month.
They sure did.
So you used to have to wait 90 days before you could prescribe it. Now you can prescribe it immediately. We've had patients with inflammatory bowel disease, with colitis, Crohn's.
And it helps that.
It really does help patients with low back pain who have had spinal stenosis and chronic back pain, and it relaxes them. And it's been wonderful. and I'm very judicious on who I prescribe it for.
I'm sure you have to be careful.
Yes, and when I see these patients with certain diseases that are really not amenable to treatment, and you see them getting better, you really
become a believer, don't you?
Yeah, you do. It's just one more modality that we can use to help patients.
Right.
And it's been, we only have a handful so far, but our phones have been lighting up because they know that they've gotten referrals from other people.
They know you've got the cannabis.
Well, it's not cannabis; it's low THC that we write for. But it's been very effective. It's very in the embryonic stages right now.
I'm sure.
And we're learning more and more about it. New information's coming out. But
how often, how many practices would you say are prescribing medical marijuana now? Are you one of few, or?
I think I haven't checked recently, but I think there's about 50 in the county. It is
in Palm Beach County.
Yes.
Okay.
There's an enormous amount of paperwork that goes in with it, and you really have to stay on top of it because you really don't want to send up red flags to the DEA, and you really want to be careful on how and who you're writing it for. And it's a little tedious, but it does help some patients, and it's just amazing on how many geriatric patients have benefited from it. It's really astounding.
Yeah.
So
that's great.
One more modality for our practice, and our patients love it.
I'm sure they do. So tell me, you're telling us that first you were a pharmacist and then you went into medical school. What was that pivotal moment that made you decide, I'm going to leave pharmaceuticals and I'm going to start helping patients?
I always wanted to go into medicine as I was a little boy. I remember my parents telling me that I always told them I wanted to be a doctor. And my personal health issues that I had as a child constituted my impetus for going into medicine, but I just didn't think financially I could afford it. And when I went into pharmacy, I figured, well, at least it would be a stepping stone. And then when my daughters, before I had children, before I went to medical school, there was one day I remember that I was driving to the pharmacy on Glades Road. It was after my third year of doing retail, and I said, I got to start writing the prescriptions instead of filling them.
Were there a lot of times that you saw maybe people were taking medicines that they shouldn't have been taken, or did you have anything like that made you think?
I think that I was astounded at how lack of discipline some doctors were when writing prescriptions. And it wasn't their fault. It's just that you only get 3 months of pharmacology in medical school. And we got, we're doing 5 years of education. So I think that to learn as much as the pharmacists do for medical school training is just, there's just a huge difference. And like I said, it really does help when I had one patient, actually, he was one of my mentors. He was a retired physician, and he was in his 80s, and he was still, he was getting short of breath. And he went to the Cleveland Clinic. He went to his cardiologist, and I said, let's sit down and look at your medicines. And he wasn't getting any answers. And I said, let's just change this one pill.
Okay.
And he could go on the golf course and only hit on the practice range 9 balls, and he would get short of breath. And after about 6 weeks of his changing his medicine, he can hit 25 balls, and he feels great. And he's
80, and he feels great.
He feels great. And it was just one thing in the medicine. So it kind of makes you feel good.
Yeah.
That you can see that one little thing. So I kind of, pride myself on my knowledge of my pharmacology and try not to make any mistakes. None of us are perfect. There's a lot of great physicians in this town that I have a tremendous amount of respect for. And it's nice to know that you're in a community where you have 2 good hospitals and really good
amazing hospitals.
Yep.
Great hospitals.
Absolutely. And great food.
Great food?
Great food in this town.
You think so? Which restaurants would you say have the best food?
I can't say that on the air, can I?
No? Yeah, of course you can. Why not?
Oh, okay.
What type of food? What type of food do you like the most?
I like sushi. There's a great sushi restaurant.
I love sushi.
There's a great sushi restaurant on 18th Street called Rise.
Okay.
My favorite.
I know that one.
Do you really?
Yes, I do.
It's amazing.
Yes.
Some great steakhouses. I'm a big component of moderate red meat intake.
Yeah.
Do you
have to say that?
Yes, I do. I take it with my Crestor. There's some great steakhouses in Boca and Del Rey. I think are really good.
I went to one myself this weekend.
You did?
Yes, I did.
Where?
I went to New York Prime.
It's great. Johnny Gio, one of the best general managers of all time, and Nick
Amazing
and
food
Scott.
every time.
I know the
It
management
is
very well. The owner
spot on.
The owner is a patient of mine. He was a really great guy, Jerry Greenbaum. Hello, Jerry.
Hi, Jerry.
But Johnny Gio's run that place. He's amazing. And Nick, Cut 432 on the Ave in Del Rey.
Yep, I've
and
been
there's
there.
a really amazing restaurant in Del Rey over top the Sandbar. It's called Ocean's 50. It's an amazing. They have great fresh fish.
Yes.
It is the atmosphere is unbelievable. Looking over the ocean.
Yeah.
So,
I've been there too.
Oh, you have.
Oh yeah. I love this town. I know this town. I've been here a long time actually. I'm from New York, but I've been here 16, 17 years now.
So there you go.
Yeah. How about you? You moved around.
No.
No?
I've been here since I was 18 years old. I've been here since the 70s and never left.
And where were you before that?
I was
In
born
Philly.
I was in Philly, but I was raised in South Jersey, a really small country, rural town
Okay.
outside Atlantic City.
Okay.
And just never left. And my sisters are up here, and shout out to my sisters in Palm Beach and Stewart. My mom, she's 90, God bless her. She lives in Boynton.
Wow. God bless. Yeah.
And so, yeah.
Yeah. Well, since we're giving shout outs, hey, Dad, I know you're watching. I love you. And to my munchkie angel, I see you, babe. So what else can we talk about?
What I'd like to, just to emphasize to, people who are, looking into this, I think that, I wouldn't you dissuade yourself from spending, the money from doing concierge because, like I tell this patient, people have no problem spending, $1,500 for TV or spending $100 a month, eating out to restaurants. And this is about your health. And we really try to do a lot of preventative health care. We've picked up, so many things for patients as just doing preventative health care.
Like what? Like what exactly for preventative? We're actually going to go to break. Don't go anywhere. We'll be right back with your second guest. Thank you so much.
All County Healthcare, Inc. is locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision and only your decision on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096.
Getting older is not for sissies. That's what one of my patients says. And it's funny, but it's true. Live long enough and you'll get arthritis, skin cancer, probably one of the common chronic diseases like CHF, COPD, diabetes. At All County Healthcare, we teach you how to manage your disease. We make sure you know how to take your medications and how to recognize signs and symptoms before requiring hospitalization, no matter how many visits it takes. You didn't move to Florida to be sick. You moved here to enjoy the rest of your life. And that's exactly what our team of nurses, therapists, and aides at All County Healthcare help you do.
You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
You and Your Doctor, Living Longer and Healthier, being sponsored by All County Healthcare, a Medicare certified agency. If you have any questions, call 1-888-717-7170 and ask for Maddie. She will answer any of your healthcare questions. This broadcast will be repeated next Tuesday at 11 a.m. and 3 p.m. on 95.3 FM and 1470 a.m. We are live streamed on All County Healthcare, Inc. Facebook page and also on our website, www.allcountyhealthcare.com. www.allcountyhealthcare.com. Well, now we have our second guest. I'm very happy to introduce our trauma surgeon, Dr. Nur Huss.
Thank you.
Thank you so much for joining us on the show today.
Thank you for having me.
Yes. How was the ride in? Was there a lot of traffic?
No, it was perfect.
Yes?
Even though it was, it's the afternoon, no problem.
Okay, I'm just going to move this over for you.
Sure. You can get close.
Perfect. So Dr. Huss is a general surgeon in Delray Beach, Florida, right? And we're going to focus today on chest wall reconstruction,
Yes.
traumatic chest wall reconstruction.
Yeah, it's a mouthful.
Okay. Yes, it sure is. Because I was looking, and trauma surgeons have such a wide array of services that they perform on a whim. So you have a really crazy lifestyle, I'm sure.
Yeah, you have to be ready, as you said, on a whim, to be ready to take care of from head to toe,
Yep.
regardless of the multiple injuries. You might be dealing with a chest, heart injury, lung, legs, abdomen, liver, you name it.
I was also reading about the responsibilities of a trauma surgeon, and you have to actually run around the ER and prioritize which patients need to see you first. So you have to kind of...
Yeah, that's we call that triage, and that is true. You can imagine some people will require an emergent procedure to be done, and it's more important to take care of those that potentially would die first.
Right.
So you have to sometimes make those tough calls. Who's going to be seen first? Who's going to be seen second? What am I going to do? And also within the same person, they might have multiple injuries that will require multiple, let's say, surgeons.
So then you're working closely with orthopedic surgeons, neurosurgeons.
Yes.
Very interesting stuff. You're based out of Delray Beach Medical Center, right?
Correct. It's a level 1 trauma center in South Florida. And we are basically open. It's interesting and extremely gratifying to be able to do that.
I'm sure the adrenaline kicks in while you're at work and something serious comes in.
I think so. It's you never know what's going to roll in. All you get is a message saying there's a trauma coming in and some sort of estimated time of arrival, 5 minutes, 3 minutes, whatever that may be. And then in your mind you have to run through, okay, you get a bit of something, whether it's a fall or a car crash or a gunshot wound or a motorcycle, etc. And you have to formulate immediately some sort of a rudimentary plan. And then as things roll, you have to change
times 10.
Yes.
Wow, that takes a lot of talent. That's pretty amazing. I'm very glad that you decided to join us today. And let's talk a little bit about the chest wall reconstruction. Why would somebody need chest wall reconstruction?
So imagine that someone has either fallen even from standing. This is a common injury that we see. Extremely common. Simply a trip and a fall, a car crash, a motorcycle crash, anything that results in a person falling down from height. Sometimes it's not even that high. Fall from standing is 5-6 feet. That's oftentimes enough to break ribs. And up until fairly recently, we would have no real solution to it. We would just say, hey, we're sorry, you have a broken rib. There's some pain medication. Relax for 2 months, maybe 3 months. And
it'll move back into place? Or
sometimes it does,
work?
And sometimes it doesn't. And that's where the issue is. Let's say, especially on high-speed motorcycle crashes or car crashes.
Oh, man, I see those guys zipping on 95, and I get so nervous. I'm a mom, so I get, oh, my goodness, that person, what if the driver doesn't see them coming through? It's pretty scary. You hear about motorcycle crashes all the time.
A lot of these are obviously emergent. But some of them are semi-elective in a sense that someone had their ribs broken, doesn't matter how. Let's say they fell from a stool, from a ladder, from standing, and they had 2 or 3 ribs that broke. And maybe one of them did not heal appropriately. And then they come to the office complaining that they feel a clicking sound, or every time they bend over, they all of a sudden they lose their wind, so to speak, or they can't take a full breath because of pain that is sharp. They complain they cannot lay down on that side. They cannot go to sleep on that side. Some of them complain that they can't go back to their jobs.
Wow.
So it can be debilitating. Most of the time it heals. But oftentimes when the ribs are displaced, meaning if this is a rib and it's displaced more than 100% of the width of the ribs, then as you breathe,
there's going to be movement.
There is movement. It can tear the lungs inside. It can tear vessels, nerves. So again, it oftentimes heals, and most of the time it does, but certain fractures and certain injuries do not heal appropriately. And that's where the chest wall reconstruction part comes into play.
Wow. It's amazing how fragile the human body is. Oh.
At the same time, it's extremely resilient.
Yeah?
Because if you think about the forces that took part to cause these injuries are amazing. It's an amazing amount of force that it takes to break someone's rib cage. And at the same time, it protects all our vital organs behind it.
Right.
So it's amazing that it works effectively, but sometimes it needs help.
And that's when you come in.
Yes. So I started this when I had a few motorcycle police officers that were injured in a similar fashion.
Okay.
There are actually 4 of them. And we basically control their pain. So here, there's some pain medication, time will pass, and things will heal. Well, they healed, but they didn't heal well. And none of those 4 were able to go back to
work
do their
fully.
job.
Oh, wow.
They were involved then with pain clinics.
Right.
And they did desk jobs, but they could not do what they used to do. Until one of them picked up on it on the internet and came to me and asked me, can I do that for him? At the time, he would only do it emergently. And basically what happened was, said fine, and we repaired his ribs. Within 3 months, he was able to go back on his motorcycle.
Oh, really?
So no more a desk job. And then...
You changed his life.
Changed back his life. He gained back his life, I should say.
That's great.
And soon after, his 3 other buddies say, hey, maybe you can do the same for me. And those are my first 4 that I did semi-elective, in a sense that this is already now 6, 7, 8 months after the injury.
Right.
And clearly they did not go back to normal.
Okay.
And now they are.
And all of them are now back to work, doing what they love.
Yes.
That's great.
And
how many procedures would you say you do on a monthly basis? And are they all at the hospital, or do you do some outpatient as well?
So these are all inpatient.
Okay.
We've done quite a lot for the past 7 years. I don't even know, but it's hundreds.
In 1 year?
In 1 year for this particular type, I have to look.
How about you yourself? How many surgeries would you say you...
For trauma, thousands. In this particular instance, it's probably measured in hundreds, a couple hundreds.
That's incredible.
It's also, you realize that you can't predict when something is coming. It's not a regular type. It's trauma. You can't predict when bad things happen.
Right.
But invariably, they do.
A lot.
And somebody has to take care of it.
Well, thank goodness you're here. So do you have a practice yourself?
I do.
Are you on Linton?
I work in Del Rey, yes, in Linton Boulevard.
Okay.
We also do general surgery.
Okay. What kind of general surgeries?
So anywhere from hernia repairs, whether it's groin hernias, we call that inguinal hernias.
How does that work? Because I hear about these things and I really don't know what they are. I know a hernia can be had from lifting something that's too heavy.
Yes.
That's all I know.
So that is the classic way. If somebody overstrains themselves in a period of time over years, you basically have something, an internal organ that is pushing against our abdominal wall.
Right.
And when there's a defect, with enough time and enough effort and enough repetitive motion, the defect becomes bigger and bigger until, let's say, a piece of intestines kind of sticks out.
Oh.
Oftentimes, it's not a problem because you can push it back in, but it just usually doesn't get better. The hole gets bigger. At some point, a piece of intestines gets stuck. Then it's an emergency.
So you're basically doing any kind of surgery having to do with major organs, anything in the midsection of the body?
Midsection, mostly, let's say, abdomen and chest.
Abdomen and chest. Yeah, where all the important stuff is.
Well,
It's all important, but
everything is important.
That's great. So, Linton Boulevard. So, tell me about your staff. What do you have going on in your office? Do you have a couple of physicians? Is it just yourself?
I have a partner. His name is Eugenio Rodriguez.
Okay.
And we have wonderful staff that helps us see the patients,
right,
take care of all their needs when they're there, make sure that appointments are done in a timely fashion, make sure that everything related to their insurance is set. It's a well-oiled machine, and it takes quite a lot of effort, especially in today's age, to deal with insurance companies.
Yeah, it sure does.
Yeah. And the office is essentially on Linton and Military.
Okay.
So it's close.
I know the area. Yeah, it's not far at all.
And, we're fairly busy. Both with...
How many patients a day?
A day? Probably daily in the hospital, about 20, 25.
So you round on 20 to 25 patients in the hospital?
Yeah, probably on the average, I would say that many.
Daily?
Daily.
That is a lot.
And then we have office visits that between me and my partner.
These are mostly pre-op and post-op?
Pre-op, post-ops, exactly. I would say anywhere between probably another 10 to 20. So on a daily basis, approximately anywhere between 30 to 40 people.
So you've got your reps in. You know what you're doing.
Yeah, you have to.
Lots of practice here.
Yeah, plenty of practice.
That's great. So how long have you been practicing?
Since 2012. I'm sorry, since 2010.
Since 2010. Okay.
In this capacity.
In this capacity. Yeah. So you went to University of Miami?
Correct.
What was that like?
That was a great experience.
You had a good time?
Yeah, I mean, South Florida, University of Miami. I did my residency in Mount Sinai Hospital.
My mother works at the Mount Sinai in New York, though.
Oh, in the New York.
In the New York, yeah.
This one is in Miami Beach.
Right. That's nice.
It's also wonderful experience, wealth of cases, which is what you want in your training. You want basically to be able to see everything. And see a lot of it. And we were fortunate that South Florida provided that.
Yeah.
Because you have all wealth of lives, you have diseases from acute to chronic, and that's what you want in your training.
Yeah, a little bit of everything.
Yeah, a little bit, actually a lot of it.
A lot of bit of everything.
I feel that exactly that's what we got.
How long have you been in Florida? Or are you from Florida originally?
Originally, I'm from Israel.
Okay.
So I was born and raised in Israel. In Florida since 1989.
So it's been a while.
Yeah, it's been a while.
It's been a while. That's a while. So have you always been out of Delray, or did you move around Florida?
Prior to Delray, I was in Pensacola, Florida. And then I moved down for family reasons. And now I'm in Delray. I'm happy that I've made that transition.
Yeah.
I have a great partner at work, and we work very well together. We oftentimes cover the surgeries we do together, and it's just more efficient this way.
That's great. So you both can be in the same room?
Oh, yeah.
Performing surgery?
Yeah.
That's great. So what's that like? Do you guys have music playing in the background while you're doing your procedures?
Yes.
Really?
Yeah.
Tell me about that. What type of music do you guys put on?
Anywhere, I like everything.
Yeah.
So, and I try to also please everybody that is in the room.
Well, you can't please everyone.
I can try. So we have all forms of music.
I'm sure a lot of classic rock and
everything.
Everything.
Literally everything. Jazz, reggae, you name it. It's there.
That's great. Yeah. Interesting stuff. So what else would you like to discuss? We talked about the chest reconstructive surgery. I know that you have a broad spectrum of things that you do and services that you perform. Tell me your favorite thing to do.
My favorite is, actually, I guess the two most favorites would be the chest wall reconstruction, which is what we discussed. And after that would be abdominal wall reconstruction. So for the abdominal wall reconstruction, that is very large hernias that most other surgeons don't want to touch.
And why is that? Is it because it's a higher risk, or?
Higher risk, more challenging, takes longer, more complex.
But you love those.
I love those. I love the challenge, and have great patients that are extremely happy and grateful. It's extremely gratifying also to be able to help someone, especially those that, they went to a few other physicians and they were told no.
Right.
And then you're the one that says,
you're their
I can
saving
do it,
grace, right.
And especially when you can do it and you're confident and able to do so. And the outcome is such that they're, extremely...
Well, I mean, you telling us about the 4 police officers that were able to go back to work after being out of work, that's a big
we have
example.
Countless such as that, and I've been very fortunate to have those.
How much of your trauma would you say is pediatric?
In Del Rey, there's not a lot.
It's very small. Yeah.
It's just the nature of the area is such that pediatric trauma does not take a high volume. In my experience, I've done a lot of pediatric trauma because where I was prior, we had a large pediatric population. And I enjoy that too. It's a completely different ball game.
I'm sure.
And, has its own stressors and its own things you have to focus and pitfalls and techniques that are completely different and unique to pediatrics. Here, not that much.
So you get a lot of slip and falls, auto accidents.
Constantly.
Constant auto
motorcycles.
accidents. I'm sure.
I mean, it's Florida. The weather is beautiful.
So a lot of younger people, or what would you say? Is it like all age ranges that you see?
All age ranges. It is literally all. And the Boca del Rey area is probably more advanced in age as a whole.
It's a great place to retire.
So and there are a lot of retirees from New York, for example.
Yeah.
But at the same time, there are still quite a lot of young people and
acting crazy,
especially when the weather is nice and it's nice and warm outside, and motorcycles provide
colleges down here. Yeah.
And then you have the not so nice things, the crime related, stabbing, shooting that people don't realize. Most are not on TV, but they do occur.
Yeah.
And so we literally, you just don't know. You might start in the morning with somebody that was, for example, last night, we had a guy that was, let's say, hit by a truck with a mirror as he was on the side of the road.
Oh, my goodness.
And had all damage to the face and everything that dealt with that.
How awful.
And then immediately after, there were 2 people that were involved in a car crash where the car hit a semi-trailer and rolled over.
Oh, my.
And at the same time, a motorcycle crash, came.
So you had 3 different traumas all at the same time?
And then a 4th one arrived. Yes.
Oh, my goodness.
So now you have to decide, okay, who I'm going to do first.
Who needs you the most?
Who needs the most, and what do I need to do? And, you have to make decisions.
So quick thinking.
Yes.
Wow.
And there's no way back, right? It's a one-way street.
I would be terrible at that job.
And you can't vacillate. Should I do this? You got to, make a plan, stick with it, and
I've read there's a lot of time and training that you put in order to be where you are today. Right?
I think that's true in
most fields, but especially trauma. I mean, I see.
In this case, it might be true because you literally... you got to be this sort of jack of all trades.
Right.
Again,
there's not just this one thing that you do and you perfect and you're perfecting your craft. No, there's like 100 things you have to do and be perfect at.
Yeah, at the same time.
Right.
So I need to be able to, and sometimes things come in series. For example, 2 weeks ago, we had 3 people that attempted suicide by slashing their throat.
What a way to go.
Yeah, but somebody had to
Find them?
Deal with that, and then luckily they're unsuccessful, not due to lack of trying, but we managed to
Stabilize the three people.
and repair all 3 of them. They hopefully have another chance to get help with the issues that they're going through.
That's incredible.
And you just don't know what's going to appear at the same time.
So you always have something interesting to talk about at the dinner table after work, huh?
Yes. Well, it's not necessarily the best for
Probably
dinner
not
conversation.
dinner time, right?
But yes, it's there.
That's pretty intense, I'm sure.
So that's the emergency part, and then we have also the more relaxed elective surgeries.
Right, the elective surgeries. That was going to be my next question, actually. When would a patient find themselves in your office, other than just trauma? Other than coming to see you after you perform the surgery at the hospital? Do some patients get referred to you by other doctors?
Yes. So we do a lot of what I consider bread and butter general surgery.
Okay.
Gallbladder surgery, laparoscopic. We do a lot of laparoscopic surgery. This is minimally invasive, with the camera. So gallbladder surgery, hernia operations are the most common in general surgery. And that would be the most elective type referrals that we get. Anywhere from that, including the abdomen or the chest.
Mm-hmm. That's great.
Yep.
So if any of you want to ask Dr. Huss any questions, or you want to get in contact with his office, you can reach them at 561-330-4695. They are based out of Delray. Doctor, thank you so much for joining us tonight.
Thank you very much.
We're very honored to have you on, and best of luck. Thank you. Good night to you all. Thank you for joining you and your doctor, and we'll see you next week.
Thank you.
Thank you for letting us share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2 TV at 866-244-5422, and we will put you on the air as soon as possible. Tune in next week for more information on living longer and having a healthier life.
The opinions expressed on the preceding sponsored program were strictly those of its hosts, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors.